You could be carrying nearly 11 pounds of trapped stagnant fluid inside your body right now, and almost nobody is telling you the real reason why. You wake up bloated. Your rings feel tighter every morning. By evening, your ankles swell, your face looks older, heavier, exhausted. Maybe you already spent money trying to fix it. Expensive massages, fancy detox teas, compression wraps, spa treatments promising lymphatic drainage for hundreds of dollars. And despite all of that, nothing truly changed, because the real issue was never explained to you. Here's the uncomfortable truth Dr.Camila says most people never hear. Your lymphatic system may be slowing down, and the wellness industry profits when you stay confused about it. They sell symptom relief while ignoring the actual mechanics happening inside your body. Nobody explains the physiology. Nobody explains why fluid gets trapped in the first place. And the longer it stays trapped, the more exhausted, swollen, inflamed, and mentally foggy you become. Subscribe and like the video if you want health information without the filter. Help this channel reach 100,000 subscribers. I'm Dr.Camila, and after years of studying chronic swelling, fatigue, and fluid retention patterns, I can tell you this clearly. Most people are treating the symptoms while completely ignoring the system responsible for clearing waste from the human body. And once you understand how this system actually works, your entire view of health changes. Because your lymphatic system affects far more than swelling. It influences your energy, your immune function, your skin quality, your mental clarity, your recovery speed, even how old your face appears. This is not motivational wellness talk. This is human physiology. Your body is constantly producing waste every second of the day. Your brain alone burns enormous amounts of energy 24 hours a day. And whenever cells create energy, waste products are produced. Dead proteins, metabolic debris, cellular fragments, inflammatory byproducts. That waste must be physically removed from tissues. If it isn't, your body starts functioning in a dirty internal environment. Patients describe it the same exact way over and over again. I wake up tired. I feel foggy until the afternoon. My face always looks swollen. I feel inflamed all the time. Most people blame aging or stress. But many times the real issue is sluggish lymphatic drainage. So let's simplify what the lymphatic system really is, because most people have absolutely no idea. Your blood circulation system is a closed loop. Blood leaves your heart through arteries, reaches tissues through tiny capillaries, then returns through veins back to the heart again. Continuous circulation. But the lymphatic system is completely different. It begins in your tissues themselves. Tiny microscopic vessels collect excess fluid that leaks from blood vessels into surrounding tissue spaces. Imagine storm drains underneath a flooded street. When fluid accumulates where it should not remain, the lymphatic vessels collect it. That collected fluid becomes lymph. And this lymph carries waste material away from tissues so your body can eliminate it. But here's the key point most people miss. The fluid moving through this entire drainage system comes from the water you drink every day. If you are chronically dehydrated, the drainage process slows dramatically. Waste removal slows, fluid stagnates, swelling begins. This is why one of the biggest mistakes people make is drinking less water when they already feel swollen. It sounds logical at first. I'm retaining water, so I should drink less. But physiologically, that is backwards. Your body needs enough clean fluid volume to flush tissues properly. Chronic dehydration is one of the most overlooked causes of edema, which is simply the medical term for fluid trapped in tissues. Dr.Camila recommends hydrating strategically, especially early in the day. Morning hydration matters because movement during the daytime helps push lymph through vessels. Unlike blood circulation, the lymphatic system has no central pump. No lymphatic heart exists. Lymph moves when your muscles move. Every step you take squeezes lymphatic vessels. Every muscle contraction pushes fluid forward. That is why sedentary people often feel more swollen, heavier, and more fatigued. The body depends on motion to create drainage, and temperature matters too. Warm water supports the body differently than cold water. Ice-cold water forces the body to spend energy warming that fluid before it can fully utilize it internally. Warm water closer to body temperature integrates faster into circulation and often feels easier on digestion and tissue movement. Start slowly. A few comfortable sips first thing in the morning, then continue gradually. Over the course of the morning, many people tolerate 700 to 1,000 milliliters comfortably when taken slowly. Your urine gives you one of the simplest hydration indicators possible. Pale, nearly clear urine usually indicates adequate hydration. Dark yellow urine strongly suggests dehydration. Your body also signals thirst through specialized receptors in the brain, called osmoreceptors. They monitor the concentration of salt and water in the blood. When dehydration begins, those receptors trigger thirst. But by the time thirst appears, mild dehydration already exists. That means waiting until you feel thirsty is often too late. Consistent hydration throughout the day is far more effective than drinking huge amounts all at once. Now let's talk about where lymph actually travels. Eventually, lymphatic fluid drains into two large ducts near the chest, called the thoracic ducts. From there, the fluid empties into the veins and returns to the heart. The body then filters and eliminates waste, primarily through the kidneys. But remember, lymph only moves effectively through physical mechanisms. First, muscle contractions squeeze lymphatic vessels during movement. Second, breathing creates pressure changes inside the chest cavity. Third, nearby blood vessel pulsations help push fluid along. And this breathing component is incredibly important. Deep, diaphragmatic breathing literally creates a suction effect inside the chest that helps pull lymph upward from tissues throughout the body. There's one simple exercise DR.Camila often teaches patients because it mechanically enhances this effect. Stand upright, slowly raise your shoulders while inhaling deeply through the nose. Expand your chest fully. Then slowly lower your shoulders while completely exhaling. Relax at the bottom of the breath. Repeat several times. Here's why this works. Deep inhalation expands the chest cavity while the diaphragm moves downward. That pressure change helps draw lymph toward the chest cavity where drainage occurs. Then exhalation resets the system for the next cycle. Repeating this rhythm acts almost like a manual pump for lymphatic circulation. Many people notice their face appears less puffy afterward. Their chest feels lighter, their body feels less stagnant. And it costs absolutely nothing. Now let's discuss the patterns swelling creates in different areas of the body because the location often matters clinically. If swelling appears mostly in the face, especially around the eyes and cheeks, old head injuries sometimes become relevant. Not necessarily major trauma. Even childhood falls or sports impacts can create tension patterns in fascia and connective tissues surrounding the skull and neck. That tension may influence drainage pathways over time. When those restrictions are addressed manually by trained professionals, some patients notice dramatic reductions in facial puffiness. If swelling affects the entire body more diffusely, posture and spinal mechanics often matter. Years of sitting compress muscles and connective tissues. Blood vessels and lymphatic vessels running through those tissues may become partially restricted. Think of bending a garden hose. Flow decreases. Improve posture, mobility, and muscular balance, and drainage often improves as well. Some people notice visible reductions in swelling surprisingly quickly after improving mobility and posture mechanics. If swelling concentrates mainly in the legs, especially with sock indentations at night, core weakness and pelvic pressure may contribute. Weak abdominal support changes how pressure distributes inside the abdomen and pelvis. That pressure can affect circulation returning from the lower extremities. Improving core stability and increasing movement may help restore better fluid return from the legs. But there is one extremely important exception everyone must understand. Sometimes swelling has nothing to do with lymphatic stagnation alone. As people age, especially after 60, heart function may gradually weaken. When the heart cannot pump efficiently against gravity, fluid accumulates in the lower extremities. This is called cardiac edema, and this situation requires proper medical evaluation. Breathing exercises and hydration are not substitutes for cardiology care. Persistent swelling, shortness of breath, chest pressure, or sudden rapid fluid accumulation should always be medically evaluated. That distinction matters greatly. Age changes risk patterns significantly. Now let's discuss one of the most effective full-body activities for lymphatic circulation overall: swimming. Swimming combines nearly every beneficial lymphatic mechanism simultaneously. Your body becomes horizontal, reducing gravity's pull on fluid accumulation in the legs. Your entire body moves rhythmically. Arms, legs, core, shoulders. Deep breathing continuously activates thoracic pressure changes, and water itself creates gentle compression around tissues across the whole body. Many people notice they urinate more after swimming because fluid movement and circulation improve dramatically. Few exercises stimulate full-body lymphatic circulation as effectively. Outside of swimming, the best approach is full-body movement in general: dancing, hiking, running, sports, mobility work. Anything engaging the entire body rhythmically tends to support circulation better than isolated spot exercises. The body functions as an integrated mechanical system, not disconnected parts. Here's the most important thing Dr.Camila wants you to remember. Lymphatic stagnation develops quietly, slowly, gradually. It rarely creates sudden emergencies. Instead, it accumulates over years until people accept fatigue, puffiness, brain fog, and swelling as normal aging. But many times, it is not normal. Start with simple foundational changes. Drink enough warm water consistently. Move your entire body daily. Practice deep diaphragmatic breathing. Improve posture and core stability. Prioritize activities that stimulate full body circulation. And if swelling persists or worsens, seek proper medical evaluation to identify the true cause instead of endlessly masking symptoms. Because real health begins when you understand how your body actually functions mechanically, not through trendy marketing, not through miracle detox products, through physiology, through movement, through circulation, through restoring flow. That's the conversation too many people never hear. I'm Dr. Camila, and this channel exists to explain what others often oversimplify or ignore completely. Subscribe, leave a like, and help this channel reach 100,000 subscribers. One informed person at a time.